related to urea cycle disorder. So as in the previous video, I have discussed more about the urea and the urea cycles, and our students of B.Sc Operation Theatre and Anesthesia Technology wanted to share some of the case studies with you regarding the urea cycle disorders. So let's see their case study and solve it basis.
Hi everyone, we are from SNS College of Allied Health Science from the Department of Operation Theatre and Anesthesia Technology. Today we are going to discuss the case study of urea cycle disorder.
I came across a patient was related to hyperammonia and I wanted to discuss it with you.
Sure, Biochemistry, tell me about the case.
The patient is 25 years old man and was admitted with confusion and vomiting and lethargy after heavy protein meal. And lab reports show very high blood ammonia and low blood urea nitrogen and mild respiratory alkalis.
Sounds like a possible urea cycle disorder. Did you check for specific enzyme significance?
Yes, genetic tests revealed a deficiency of ornithine transcarbamylase. Interestingly, his mother was a carrier since it's an X-linked disorder.
Exactly. OTC deficiency is the most common urea cycle disorder. What clinical features did you present here?
Apart from the confusion and vomiting, he also had a turbidity and tremors and disorientation. It treats this can progress, can coma, even a death.
Correct. Ammonia accumulation is neurotoxic. Now, how do you diagnose such a case biochemically?
Plasma ammonia levels markedly elevated, uric acid in urine.
Very good. What treatment?
The treatment was the patient was given low protein diet, sodium benzoate and sodium phenyl acetate to divert nitrogen excretion and alkaline supplementation to support residual urea cycle function.
Excellent. What is the clinical significance in this case?
It highlights that urea cycle disorder through RAD can present even in adults after stress, illness or portion load.
Well summarized, Biochemistry. Remember, urea cycle is essential to detoxify ammonia. Any block in the cycle can be left life-threatening.
So the conclusion is this case demonstrates how deficiencies in urea cycle enzymes, especially OTC deficiencies, leads to hyperammonia, neurological symptoms and metabolic disturbance. Early diagnosis with biochemical testers and prompt treatment with dietary management and nitrogen scaling drugs can help.
So Madhumita and Igneshwari have discussed urea cycle disorder on hyperammonemia, where ammonia levels is high due to the intake of high protein meal. So previously the patient they discussed was after having a heavy meal, they might have experienced the confusion, vomiting and lethargy. So it is due to the high buildup of ammonia in blood, and moreover the blood test also shows the amount of ammonia in blood is high. So this ammonia has to be converted into urea and it just excreted in urine. But this metabolism will impair in that specific patient. So the patient did not convert toxic ammonia into urea. So the ammonia is built up in the blood and it leads to hyperammonemia. And another case study is waiting. Let's see about that case study.
Hello everyone, myself Durga and she is Monica Shri. We are from SNS College of Allied Health Science, studying in the Department of Operation Theatre and Anesthesia Technology. During our clinical proceeding, we have gone through many interesting cases. In that, one really stood out, that was urea cycle disorder.
Yes, it is powerful reminder that we have learned in chemistry. It was a grateful experience to share this case history.
Coming to the case introduction, the patient was 2-day-old baby boy. He was normal at birth, but after 48 hours, his parents noticed he was vomiting, not feeling well, becoming unusually sleepy and breathing very fast.
At first, it was looked like an infection. Lab test shows high blood ammonia. Blood test shows high amount of ammonia in the blood, low blood urea nitrogen and arotic acid in the urine. it shows ornithine transcarbamylase deficiency in the newborn baby.
In ornithine transcarbamylase deficiency, the second enzyme, ornithine transcarbamylase, doesn't work. That means ammonia buildups and carbamide phosphate is stuck in another pathway, producing orotic acid.
Ammonia is very toxic to the brain. It affects severely in neurotransmitters, increase intracranial pressure, and can cause cerebral edema. The patient shows irritability, confusion, vomiting, sneezing, and coma.
In neonates, these symptoms can progress very quickly. Without rapid treatment, the damage can be permanent or even fatal.
Diagnosis and treatment: plasma ammonia levels, plasma amino acid, urinary orotic acid, genetic testing.
A first priority is to lower the ammonium levels. Quickly, doctors may give nitrogen scavenging medications like sodium benzoate and sodium phenylacetate.
If ammonia is dangerously high, hemodialysis may be needed. For a long-term care, patient follows a low protein diet.
For us, the key takeaway was how a single enzyme defect and disrupt the whole metabolic pathway and endanger life within a hour.
And it is not just rare. Knowing this pathway can help differentiate causes of newborn illness. It also underscores the importance of newborn screening programs, genetic counseling, and early innovations.
So that was our case-based study on urea cycle disorders, a powerful example of biochemistry at work in the clinic.
It reminds us that understanding the urea cycle isn't just an example, it is about saving lives. Thank you everyone.
Yes, our students of OTAT have discussed two main case studies as they have come across through the clinical posting, and both case study was related to the one enzyme deficiency in urea cycle. So as I said before, there are mainly 5 enzymes in urea cycle. So whatever the 5 enzymes will work properly and function properly, the resulting urea end product will be released in our body or excreted in our body through urine by the kidneys. So if any one of the enzymes is deficient, the urea cycle does not carry it in our body, and moreover the more toxic ammonia is built up in our body. So take necessary measurements and necessary precautions to avoid the urea cycle disorders. Thank you.